Emily Mendenhall is an assistant professor of global health in the Science, Technology, and International Affairs program in the Walsh School of Foreign Service at Georgetown University. She is a member of the Global Health Initiative Faculty Committee. Professor Mendenhall received her PhD from the Department of Anthropology at Northwestern University and MPH from the Hubert Department of Global Health in the Rollins School of Public Health at Emory University. In 2017, she was awarded the George Foster Award for practicing medical anthropology by the Society for Medical Anthropology. I'd like to welcome Professor Emily Mendenhall.
So what is global health? There's a lot of ways to think about it. How much experience do you guys have with this idea of global health? Quite a bit. So global health is this field that's really emerged in name in the last 20 years. And people have moved beyond, if you think about international relations and health, kind of the earliest work was explorers, colonial medicine, which was kind of paired with these emerging ideas about hygiene in, for example, in Europe and the U.S. This was kind of resembled in the earliest public health schools, which were called schools of hygiene and tropical medicine. Then when more bilateral, post-colonialism, bilateral relationships and international affairs were emerging, people were still kind of conceptualizing this idea of international health, thinking of health as this kind of external experience. And in the last 20 years, people have kind of started to break down these historic structural inequities in thinking about ideas and power and funding and collaboration to move towards thinking about what global health means and what it might be. So the idea, so when I think about global health, I think it as kind of a historical process, and I actually think in the next 10 years we're going to move towards what Richard Horton, the editor of this journal called The Lancet, he talks about planetary health, and as this kind of climate, more global, we're moving beyond this kind of global notion, right, to this emergency state of what is health. Well, you can't think of it beyond, dissociated from the idea of climate and the idea of the whole kind of organism in which we live. So kind of thinking even beyond global health is important. But global health itself is an idea, it's a movement, it's an organizing principle, but who does it include? Well, it includes scientists, it includes educators, it includes logisticians, it includes politicians, it includes anthropologists, it includes political scientists, it includes virologists. It includes everyone who's interested in this global movement, from development to bench science. Anyone want to comment? Or yeah, go ahead.
Oh, I'm sorry to say that one of the things that might drive it is fear, because when the Ebola virus got here to Virginia,
absolutely,
I think people woke up. Like, what, how did that get here? And then, Maine, Canada. So it's like, it's always over there until it's here, flying in on a plane.
Yeah, and when we think about what's sexy in global health, we think about these emerging infectious diseases. And honestly, in the last 10 years, the number of newly emergent infectious diseases has been off the charts. The world is getting smaller. Zoonotic diseases are becoming more frequent, animal to human transition. There are new challenges. The field of global health security is getting more money than ever, even though PEPFAR, the President's Emergency Plan for AIDS Relief, was actually located in Department of Defense, still is. So how the U.S. perceives their interaction in global health itself is an action of domestic security, international security, national security.
I was just going to mention schools of public health and the field of epidemiology has been probably in the vanguard of, I would think, although I'm not an expert in this, of this idea of global health, because they work all over the world with different kinds of problems, trying to understand them.
Absolutely. The founding of the first schools of public health, for example, the London School of Hygiene and Tropical Medicine, were in the late 1800s, early 1900s. And so they were, you know, at the beginning, the first kind of, I want to say buildings, but collaborations and communities of thinking about local and global problems and organizing that scientific conversation on the heels of political dialogues, for example, about the building of the, well, actually many different development projects in with the Panama Canal, but other kind of development projects in the U.S. And actually, before the World Health Organization, there was the Pan American Health Organization. That they kept their name because they preceded the WHO. So a lot of that organization and coordination, which was in parallel and part of the founding of these schools of public health, were through kind of these political negotiations that were necessary to respond to diseases. I mean, if you look at historically if you look at acts of war, 5 times more people died of disease than combat. Historically, things have changed, but so, you know, in many cases, health and devotion to that is to health is, you know, an act of national security and military. So I think the WHO the World Health Organization is actually one of the most radical political organizing tools that we have. And in part I say that because, well, and that's one of the reasons they are financially kind of marginalized in the global community today. And some people even say, you know, what is the utility of the WHO? You know, they're not doing their job. But in some cases, the problem is actually that they are financially really strapped. But the WHO has always been remarkably progressive. I think this is a really good example. Even in their preamble, they demonstrate how they think about health as social, psychological, and physical, which is pretty radical to how in the United States, in many ways, in countries that use biomedicine, think about health and disease. Often, especially in the United States, when you go to see one clinician, they're going to take care of that one condition that you have, and it's often a biological, a physical experience. There are some people who do more integrative medicine, but it's still pretty isolated to the physical realms, even in the United States, even though it's changing in some ways, and in some ways it's staying the same. Does anyone want to comment on this? So what makes health global? We've talked a little bit about this. The Institute of Medicine actually says health problems, issues, and concerns that transcend national boundaries may be influenced by circumstances or experiences in other countries and are best addressed by cooperative actions and solutions. Ebola, you brought up, is a really good example of how diseases cross borders and become these global challenges. And it's useful to use those examples to bring together collective action, concern, political mobility for health concerns. Because actually in 2015, more people worldwide died of diabetes than HIV, malaria, and tuberculosis combined. So it's easy to get people to mobilize around infectious diseases. HIV/AIDS was one of the first emergent infectious diseases. Ebola was a very one that got a lot of press, right? I mean, there's a huge Ebola outbreak in DRC right now. That's actually an extraordinary challenge that people aren't really talking about. And now, if it does come to our shores, people will start Googling it and really thinking about it again. Actually, I had a student who did this really interesting project looking at Google searches in relation to the media talking about Ebola, and it was right when they called it a public health emergency of international concern, a PHEIC, which is what the WHO does. It is a collecting kind of terminology. There were a bunch of Google searches, even though Jim Kim at the World Bank had sent billions of $2 billion to the 3 affected countries 2 weeks before the WHO, because he was like, come on, let's act. You know, Jim Kim's an anthropologist and an activist really deeply committed to global health. And, you know, the WHO was then really criticized for this late response. But then also when Ted Duncan in Dallas came to our shores, there was another really big recognition of concern among Americans because of the risk to their own families and individuals. Do you have a question?
I have a question. how has the fight against malaria improved or remained the same since, 1980s or something?
1980s. That's really,
The only reason why I
yeah.
ask that is that years ago, when I first went to West Africa, the mosquitoes and they're flying all around, and if you were infected, it was almost a death sentence. And now I have friends who say, "Oh, I was sick for a while, and I went to the hospital and they gave me some pills, or I went to the drugstore and I got some pills and now I'm better." So it would seem as if the problem with
Malaria.
mosquitoes is not that much of a problem anymore?
It's really, malaria is a really interesting case, and we could probably talk about it for the next 3 hours. But at the founding of the WHO, they identified 7 diseases that could be eradicated. Malaria was one of them. So was smallpox, which was the greatest success, maybe by luck, maybe not. Polio, which was been one of the most expensive, extraordinarily expensive efforts of eradication. They thought they would do it well before the year 2000, and they are still. The eradication campaign is the most difficult and most expensive at the last 1% or 0.01% to eradicate from the entire earth. Getting to 99% is actually not always that difficult. Who's the most affected at the end? Those living in conflict zones, those who are displaced or have governments have historical reasons of distrust or are meaning to displace these campaigns. So malaria was one of the initial diseases in which they tried to eradicate. They eliminated from many places, as you mentioned. But it was also probably the best example of failure. By the 70s, they'd largely given up, if not before. I think actually by the 60s, they'd given up on the malaria eradication campaign. Currently in the news, Melinda Gates has recommitted a great deal of money. She, and also, post-World War, if you kind of see the characterization of how people thought about global health, it was very much about quick technical fixes, which you can see, and smallpox was an excellent example of a possible disease to be eradicated because it was one inoculation for a vaccine, and you would be completely, prevented. You'd have this vaccine and you'd be immunized. And actually, one of my mentors from when I did my MPH, who's actually unfortunately quite ill right now, he worked in Bangladesh and Nigeria on the smallpox eradication campaign, and he said that the inoculation was an effective one, not only because you only needed one to be prevented, but you could actually have it multiple times. He's like, I've been inoculated more than 60 times. Because he would go into a community and give himself the shot to show people that it was safe. But it was a phenomenal technological success. And that campaign itself, there's been a lot written about the strike. Bill Faggy has this lovely book called House on Fire that's kind of looking back on his work. He's one of the kind of leaders who then ran the CDC, and Bill and Melinda Gates, and he's, one of the leaders of the eradication campaign. But then there's another person, Larry Brilliant, who's written pretty critically about the fact that there's forced immunization. And that there were some other tactics that happened then that probably couldn't happen now. So the success and the organization and the system of eradication, was successful in that time, and it has to be carried out a little bit differently now because people are communicating, and those sorts of actions aren't really tolerated. Although we are very close also to eliminating guinea worm, and there is a wonderful film that I think is appropriate for high school students, maybe middle school students. My husband worked on guinea worm eradication, so it's very near and dear to my heart. But it's called Foul Water Fiery Serpent. And this is Jimmy Carter's pet project. So that's a lovely 1-hour film for teaching, actually. I use it a lot. So this is actually just a map to show kind of the complexities of politics and health outcomes. This is GDP per person in US dollars per year. And this is life expectancy, child mortality, infant mortality, maternal mortality. These are some of the best indicators of health and development. And you can see a lot of the wealthier nations are here. A lot of the middle and upper middle income countries, lower middle income countries here, least developed countries here, but there's some really interesting, South Africa's here, Russia's here, US. You can see Cuba's all the way there. You can see that the role of inequality in health is pretty extraordinary. We know there's a lot of incredible work done on how a more unequal society is a sicker society, and we know that from the United States as we become more unequal, as we have in the last couple of decades, 3 decades, we have also our health has deteriorated, and we're one of the unhealthiest societies of any wealthy nation. South Africa similarly has pretty historic inequities. Russia as well. You can see Cuba does really, really well in health. They have one of the most equitable health systems and equitable societies. We don't talk about Cuba as well, obviously, because of our politics, but they have some of the most progressive health education programs. So they actually train doctors from all over Latin America, all over the world, and send them. And I think one of the best examples of health and politics is when Katrina happened, they offered to send relief workers, physicians, and we said no. We kind of probably could have used it. You can also see Japan has a really equitable health system. They have really good health outcomes. And this is, glossing over a great deal, but you can see there's actually really powerful links between health and wealth. So health problems are largely a reflection of larger social and political problems. And this notion, and why I went to public health school, and then I realized I needed to go deeper, because health is one way to think about inequality and larger social and political problems. So at the heart of these stories are the complexities in which people navigate and understand their own health problems. And so by using these stories as a stepping off point, they'll produce a lot of great dialogue about the complexities in which people live. And some of these stories are written by really great ethnographers, so you can they really paint a picture of the scene. So what makes health local? I put this up here because often when people talk about health, they talk about the hospital, they talk about the clinic, and they talk about inoculations, they talk about vaccinations, they talk about medicine. But health is so much more than that. One thing we're trying to do in our field is talk less about suffering and talk more about resilience. Talk about how people stay healthy, how people are healthy individuals or can maintain a strong mental health, and how people support each other, how people maintain strong social networks. And so flipping the dialogue can maybe be a pretty productive way. So, schools are a fundamental part of that. Such an important part of that. We know we have enough science to prove that stress during gestation, stress in your early life, can cause extraordinary health challenges later on. And these health challenges, there's this whole field of epigenetics that demonstrate that trauma, certain types of oppression or subjugation become actually embodied at the cellular level through this process of methylation that then you carry on. It's this whole process of turning some genes on and turning some genes off by smoking, for example. Or there's multiple things that can turn certain genes on or off that then you pass on to your children. So thinking about having, school lunch programs, having social support, having counselors available, having strong social networks can be so fundamental for children. And I don't need to tell you that, but thinking about the fundamental role that schools play is part of this whole story. Probably as important, or not more, or more important than even hospitals if you think about keeping people healthy. And here's just another, you guys didn't have these, I just thought they were good examples of the ways in which we think about health and having healthy lives. I just keep thinking more and more. I study this field, social determinants of health, first written about from all these different people in the early 1800s. When people were writing, Karl Marx, we had Edwin Chadwick, the social scientists, we had John Snow, who I opened the book Global Health Narratives with, in the introduction, who's this legendary, the father of modern epidemiology. There's some hidden narrative, people from the narrative of Jon Snow. For example, he developed a really close relationship with a clergy who lived in the neighborhood, who could introduce him to the kind of cultural and social complexities of the neighborhood to figure out this cholera epidemic that he unveiled. We also had germ theory. And so at this time, people were talking about the complexity in which health and medicine were hand in hand. Rudolf Virchow is the founder of, we would say, medical anthropology or social medicine, and he was writing at this time. Anyways, I work on this kind of lineage that then was pushed farther by this guy, Michael Marmot, who's people have heard his name. Anyways, working and building an understanding of how social and health problems go hand in hand. Anyways, I've been working on this too. We have all the evidence in the world, but the whole point of talking about that is for 200 years we've been building evidence to show how closely linked social and health problems are. But at the end of the day, nothing's going to change until we have the political will. So that is one of the reasons why these books exist, is to create this dialogue and to enhance understanding. And to maybe, if people want to learn more of the science, we can have links to the science, but just promoting the dialogue and the awareness of the complexities of these issues is why the books. If I get a little long-winded because there's just so much there, so ask me, just push me along if I do. So who cares about stories? Well, as you all probably know, they're fundamental for thinking about how you live with an illness. For researching, I've collected over 300, hundreds and hundreds of stories about women's lives living with diabetes around the world. They're so powerful for students to help them think about how social and health problems are linked. They move us beyond the theoretical. They move us beyond all the things I'm talking about here to really demonstrate the experience. How is it to live in the moment, to experience, to be in the world and realize these complexities? What in the preface of the book, Kate Wenskill, who I'm going to introduce in a minute, uses the word perfink from Jerome Blumer, this social psychologist. But I love it because it brings up this notion of perceiving, feeling, and thinking at once, and that's what a story enables you to do. I know this is old hat for all of you. This is what you do every day. But I wanted to bring that up and bring up Kate's notion because Kate is really amazing. She has worked in, I think it was Burkina Faso was the first place they started this project called Scenarios from Africa, and this was in the early 90s, at the beginning when the epidemic was really getting recognition. There's evidence that HIV has been in some parts of Central Africa since the 50s, if not before. But it only really got global recognition much later. But she started working with her husband and now it's all over Sub-Saharan Africa, about trying to figure out how people in communities were experiencing HIV. But she is very much an activist, academic, and so and she's also very creative. So they created this competition for young people to write stories and films about HIV and AIDS. And what they did is they have this big contest for young people to submit scripts. And this is actually would be a really cool thing. I'm sure people do this now here, but they had them write these scripts about HIV in their communities, and then they would partner with leading filmmakers in their country to make these films. And I'm going to show you one. But I have it here, and you can just have all the slides. I don't know if you just give them.
Yep, I always provide them where I'm allowed to.
Yeah, of course. I'm all about sharing everything. So global dialogues, you'll have access to that link. But let me just give you, this is one of my favorite ones. It's called Iron Underpants. But then, wait, let me just say one thing. So one of the really cool things is that they have these young people write these stories. Then the young people get the experience with these filmmakers to produce these stories, and then they use these stories as tools, and they bring them, community health workers bring them to different communities to spark dialogue, to talk about the stories that are coming from the young people in these communities. So it's kind of cool. I don't think the sound is working.
It should be.
Oh, yeah.
Yeah, I hear it.
Should I close this? I got it.
better be going, Jackie. We'll talk very soon again, okay?
Good. We'll be in touch soon, okay?
Hey, you take care, okay?
No problem.
Okay, see you.
Yeah, guys. Thanks for coming.
Okay, no problem, brother.
Okay, we're going to match, right? Yeah?
You don't change your mind at the last minute.
It's okay.
Okay?
Hey, look at that action.
Listen, shut your mouth or you swallow a fly.
Hey, who's in charge? You or what you got in your pants?
She smiled at me. And so what?
Oh, you've got to get it under control. You saw the state Jack is in?
Only once he had unprotected sex and he caught the virus. That's right.
Listen, with all these temptations, they're amazing.
Listen, my friend, I tell you, there's condoms, they're really effective.
Correct.
But in my life now, I've chosen another method. It's really simple. You can sum it up in 3 words. But you have to be strong, a real man.
Are you sure it works?
Oh, no question.
That's what he said.
Well, that's great. Hello?
Money, sir.
I've got a little job for you.
Yes?
Do you think you could make what I've drawn here in super resistant special steel?
In special steel?
That's right. Those are the measurements.
Okay, I see what we can do.
Okay.
But it's quite costly.
Oh, yes. How much?
2,000.
That's not a problem.
Okay. In that case, come back tomorrow.
Morning?
Yeah.
Okay, till tomorrow morning. Thanks very much.
Yeah. He's got to be mad. It's special steel.
Good morning.
Hello, my friend. All right?
Yeah, fine.
Ready?
Yeah?
Yeah. Do you want to take a look?
Yeah, sure.
This way. I even put in something for those rings.
Good idea.
Here you are.
Oh, yeah, that's great.
Good. Yes, I did my best to satisfy you. Okay?
Fine, yes.
Is everything all right?
Oh, yes. Good.
Oh,
Yeah, this is for you.
thanks.
Well, thanks.
Bye.
Bye.
Very much. Good day's work. Good. The key. Hey, young man, you've forgotten the key.
I don't need the key. You can keep it. I'm not going to need it.
Musa, why are you walking like that? You got a hernia?
No, he hasn't. I bet he just walked into a temple.
Hi, you guys. How are things?
Okay.
Aziz, thank you very much. You gave me excellent advice.
You being serious?
Your anti-AIDS protection is fantastic, boss. You said protection lies in 3 words.
Yes. I am under the mask.
Right.
Yes.
Exactly. Just wait.
Look,
Iron underpants.
you see, with these, there is no chance of me giving you temptation. I'll be as good as gold. It's great, huh?
Oh, this is unbelievable. It's a figure of speech. My iron underpants are here, not there. To guard against AIDS, you've got to have an iron will, not iron underpants. It happens in your head. I can't believe you did this.
Underpants made of iron.
I see. This here isn't the solution.
Mind over matter.
Iron will.
And a student made that? Students?
Young people.
Student films? Yeah.
Yeah, so, this was the winner of the competition that year. And, what did I do?
content. I hope anyway.
Anyone have some initial reactions?
Mutual understanding.
Well, we've really come a far way from when Charles Dickens was writing and humiliating the government into action. You know, now it's people like you and filmmakers, it's so good that we have more than one voice speaking out against air pollution in London.
Yeah.
Not so sure about the part of the woman walking as the temptress. Kind of a little bit like playing into the stereotypes that women are the ones that are going to be testing these men.
Yeah.
Absolutely.
That I kind of felt a little.
Yeah, no, great point.
But
Absolutely.
I know it happens. I mean, just this week I was walking here and with my dentist, and this guy just came up to me and said, "You're such an angel. You made my day today, and do you want to go out with me?" It's like, I was just waiting to go to the dentist. So it's fun because it was so funny.
Yeah. But actually, that's a great thing to talk to students about.
Yeah.
Right? To be able to have that conversation.
Yeah, why did
Great
it have
point.
to be the woman
Exactly.
smiling at him, right?
Exactly. Absolutely.
Something in thinking about embedding things into the curriculum or figuring out how to engage students with these global contexts, something we grapple with a lot is this idea of taking action and really making these global issues seem hopeful and that there's still a role for them to play and also solutions and things that can be done. And so this actually just reminds me of, you know, how you can create a project like this within the context of your own classroom and public awareness campaigns being something that students can do in the moment as a part of that unit in that class. And that's a great example of that on a larger scale, but we can bring that down to the classroom or even school level.
I should just briefly mention that when the administration of Roosevelt came to George Mason to talk about School of Foreign Service collaborating, they brought a whole curriculum plan for integrated curriculum, globalizing the curriculum, and of course they were opening in less than a couple of months. So we did some triage and addressed first the social studies curriculum, but we saw health and music and a whole bunch of other things in the arts, so we're still open to continuing that process.
So one of the things that we found, and I'll talk about this, but I think this is a good time to talk about, is we piloted it with some young people in Austin, a neighborhood in Chicago. And they were awesome. They were kind of the guinea pigs. And they read the stories, and then we asked them what they wanted to do with them. And they wrote their own stories. So actually what community health narratives is really good at is addressing a lot of local issues in the U.S. That students may really, we have some on disordered eating, we have some on gun violence, we have some on mental health, on depression. So this whole section, the first section is social ties, the second is gender and sexuality. The next one is on mental health, and we actually have communities in action at the end of every section to demonstrate a really amazing organization or group that is taking action to address some of these issues. Just as an example, unlike Cure Violence is one. We have one that talks, after mental health, we have one on violence, then we have one on prevention, and we have one on healthcare access. And actually, Bashar Shukair, the previous public health czar commissioner in Chicago, he's now left, who is actually a friend, wrote the foreword. So that's kind of cool. He talks about being the commissioner. So this one's a really good one for local issues. But I think actually paired together, and this one, especially if you're talking about climate change, we have a section on air. The first one's on water, the second's on air, the next is farms and food, the next is a changing climate, urbanization, and human impact. So this is a really good organizing one if you want to talk about climate change. And the teaching guides are included at the end of these books, but they're also online, one for every story online. And the stories were so powerful. they would just kind of write about their own narrative, whatever it is from their life that they see as their own story that could be like put in a book like this and are collected together, and that students made, put them together and then gave presentations on their own stories if they felt comfortable, and it was really cool. So I was going to, we have 15 minutes, and I was going to read the story potentially and talk about it with you all. Is that helpful, or would you rather talk about strategies for teaching these? Because the great thing about these stories is, can I borrow your book actually? The great thing about the stories is that they should be read aloud. In the tradition of anthropology, I don't know how much you still read aloud to your students. Yeah, quite a bit. I still read aloud to my students, and sometimes I think it's weird, but I make them really listen to a story or really follow some sort of narrative, because it's a different kind of listening. There's no visual, but I think it can be really powerful. So let me pull up Dots. I think this is one that I wrote. Where is it? Sorry, yeah, okay, it's 118. This is actually off of, this story is related to this, one of the most actually activist global health moments of Jim Kim's career, who's now the head of the World Bank, but he's co-founded Partners in Health with Paul Farmer, who most people have probably heard about. He's a pretty famous global health activist. But there were these really high rates of multidrug-resistant tuberculosis, and at the time the government would only recognize and treat people with tuberculosis, not multi-drug-resistant. Now there's extremely drug-resistant tuberculosis, but at the time they weren't recognizing that people weren't getting better. And so they actually stole drugs from Harvard Medical School and brought them to this community that was affected by MDR-TB and treated them. And they said, look, these people can live. And the president had said explicitly on TV, let them die. So it was an extraordinary political resistance to this dismissal of this population. So there's a lot of these stories are related to these other things that have happened or could be taught. That's one reason I told the story. So nobody could convince Anna that there was a better place in the world than the coast. Anna smiles as she thinks about what she will do when she escapes school and she has the weekend to herself. She tilts her head and closes her eyes as she envisions the great blue, green, and white waves crashing against the rocks. She almost can feel the cool breeze from the Pacific Ocean bouncing off the waves and blasting through her hair. Lima has always been her home, and she can't fathom life without water. Ana Garcia, it's your turn. Please roll up your sleeve, the nurse calls, bringing Ana out of her daydream and back into reality. This is page 119 if you want to follow along. Ana has been standing in line for her Bacillus calmette-guerin BCG vaccine for 2 hours and is not looking forward to the needle prick. I'm ready, I can do this, Ana says with a weak smile as she walks forward and looks up at the nurse. The nurse looks down at her with a tender smile. You know, the BCG vaccine prevents many TB infections. The nurse grabs the fleshy part of her arm and sticks the needle in it before Ana can protest. You'll be lucky to prevent the tuberculosis from attacking you with this outbreak and all. Ana's blood drains from her face. She looks away from the nurse and, speedily running for the door, says thanks. She doesn't look up as she passes the other students in line waiting for their vaccine. At that instant, all she can think of is escaping the blue halls of her school and reaching the solitude she finds in one place, the ocean. Ana lives in Caraballo, a slum outside of Lima, Peru. She hasn't always lived in Caraballo. Ana lived in an apartment near the center of Lima with her mother and father only 2 years ago. She attended a school she loved and did well there. Life wasn't easy, but she was happy. As Ana leaves the school grounds, she picks up her pace and starts to run. She wants to escape to her mother. She's worried about her mother. 1 year ago, Ana moved to Caraballo with her mother. Her father had died suddenly from multidrug-resistant tuberculosis, MDR-TB, 1 year, 4 months, 8 days ago. She counts each day since her father's death in a calendar she keeps under the mattress she shares with her mother. It was the day everything changed. MDR-TB, Anna thinks to herself. She shudders a little as she repeats the acronym, MDR-TB. MDR-TB is untreatable. She rolls over again in her head. They say that tuberculosis is treatable. I know it's treatable, but Papa's wasn't. Anna clenches her fists and keeps moving towards her mother. MDR-TB has become a major health problem in many countries. Bacteria have adapted, and thus the best antibiotics are no longer effective. Bacteria adapt to the environments in which they live. Mycobacterium tuberculosis, the bacterium that causes tuberculosis, has evolved to the point where it has become resistant to the drugs available to fight it. This resistance is most likely due to patients not completing their treatments, allowing bacteria to survive and adapt. In the past 2 years, Anna and her mother have learned more than they ever wanted to know about tuberculosis. When her father was diagnosed, they believed that he could be treated. The health center gave him dose after dose of every bacteria drug available. Finally, the doctor discovered that his strain of tuberculosis was resistant to every drug on the market. He died after 6 months of fighting the disease. After Anna's father died, she and her mother were forced to move to the outskirts of Lima. The tuberculosis treatments had consumed all of the money they saved. Anna's mother continues to work as a teacher, but her income is so small it's difficult to subsist on. The change that has been most difficult for Anna is living farther from the coast. The beautiful rocky coast of Lima is her favorite place to escape to. She loses herself in the energy created by the waves crashing against the rock. She often takes her journal and fleshes out her thoughts to the rhythm of the waves. Caraballo is farther away from the coast, but she takes a bus to her favorite enclave every Saturday to regain her strength. Anna finally reaches the door of her small home, which is built on a typical sand dune in Caraballo. She pushes it open and smells her mother's cooking from the afternoon meal. Her mother teaches in the morning and comes home around 3 in the afternoon to cook and put the house in order. Anna often works in the morning as a promotora, educating families in Caraballo about tuberculosis and how to prevent it. Today was one of those mornings, so she hasn't eaten since then, when her mother handed her bread and cheese, fresh cheese, on the way out the door. She opens the lid of her mother's cooking and scoops out a serving of arroz con pollo, or chicken and rice. These days, it's mostly seasoned rice only because chicken is too expensive. Today, Anna's mother is not home when she returns from school. 6 months ago, Anna's mother also developed symptoms for tuberculosis. Terrified, she went to the local health clinic, Socios en Salud, or Partners in Health, for health care. She had heard that this clinic, located near their home in Caraballo, served tuberculosis patients. She also knew that this was a nonprofit clinic, meaning she could receive safe health care without medical bills. She wasn't able to afford more treatments and battle another bout of tuberculosis. She feared her situation would be like her husband's. She promised she would never desert Anna. When Anna's mother visited Socios en Salud, her sputum test for tuberculosis showed that she had a treatable form of tuberculosis. Today, she cannot meet Anna at home because she's participating in DOTS. DOTS is short for Directly Observed Therapy Short Term. It's a proven way to fight tuberculosis. It is successful for patients with a strain of TB that can be fought by antibacterial drugs. For 5 months, Anna's mother has had to go to the clinic every day at 6 in the evening to take her medications. Anna sits down at their table and begins to eat her rice slowly as she starts her homework. Since her mother began attending Socios en Salud, Anna has become passionate about community health. Immediately after her mother began treatment, Anna began visiting the health center and volunteering in any way she could. Only 5 months later, she's working with the promotoras in her community to educate others about tuberculosis. As Anna flips to the final page of her book, A Guide for Health Educators, she hears the metal door creak open behind her. She quickly turns around and sees her mother walk through the door, full of life. Today was my last day of therapy. It's over. Tomorrow I will have another sputum test and I should be tuberculosis-free. Anna jumps from the table and embraces her mother. They begin to cry and hold each other, not letting go until the other loosens her grip. Finally, Anna's mother grabs her daughter's face and says, "If only we had known about this clinic 2 years ago." Her voice trails off and the joy begins to seep out of her voice. She gathers her breath and says, "I'm so happy to be here with you, Anna. I could not be more proud of your dedication to fighting this disease that we have battled for so long. We will make it, you and me. We will beat this disease." Anna smiles at her mother and says, "Tomorrow we celebrate and spend the whole day on the coast, you and me." Anna's mother takes her daughter's hand and holds it to her face. They take in a deep breath of fresh air and know that this time they have won. So that's just kind of one example of the stories. We try to end them all positively, so students can think about the positive outcomes and positive solutions, which I sometimes need to do more in my graduate courses. But I do think that this is a really positive way to spark conversation among young people. As you were listening, were there any kind of key themes that jumped out of you that maybe were health-related or not even health-related?
Well, the fact they had access, but the expense was, I mean, threw them out of their home into a new place.
I mean, what's the largest cause of bankruptcy in the United States?
It's got to be paying for health.
Hospitalization.
It's medical bills, exactly. The largest cause. And when you tell anyone in the UK that, they're shocked. It's a violation of our human right.
The other thing was that they couldn't eat properly. So they were just eating the rice with the seasoning. Happens a lot in Latin American countries when you could only afford the rice, which is filling but is not nutritious enough.
Yeah.
And they put seasons and pepper and things on it. In Bolivia, for example, poor people will eat a plate of rice and then the chili peppers next to it. But that does have some nutrition. That's what that is.
For students, the way that Anna becomes really passionate about this issue that has impacted her life so much, I think would be really powerful in a classroom, because so often our students are, they're experiencing certain issues, but we can't always bridge that to action or to igniting some sort of passion in becoming a part of the solution. And I think to have stories like these and examples like these, where you so clearly see her not only live this issue, but also then become so involved with the center and try to help out. And, we would love a situation where that happens with all of our students, where they can identify an issue and think, this impacts my life, but also what can I go out and do? How can I get involved? And that's kind of the aim of these courses, but also all the work that we're doing. So
I agree.
That's
one of my favorite parts of the story. Young people have power. Reiterating that you have power. You have power. You can do things on a small scale.
And she was brave. She got her shot.
Yeah.
Do you take real stories and adapt them, or how much of that story is?
So this story specifically is so almost all of them are based, actually, maybe this wasn't a great one to tell because this is actually one I told because I couldn't find one to tell it. But I've read so much ethnography by them, and it was kind of a recreation of some of their work. Specifically, I spent time in Peru, so I felt legit to write it. But it, most of the stuff I told was based on most of my research or more in-depth experience that I had. But this one specifically is based on their work in Socios and Salud. They actually have a great film series called RX for Survival. It's actually pretty dated now, but it's still really great. They have a great little cameo. I think you can actually find it on YouTube. It's a little grainy, that talks about this work with Jim Kim, and it also talks about him stealing medicine from Harvard Medical School, which I love, and bringing to this clinic to show that radical action can be transformative.
Something Kim mentioned earlier, but I think would come up with this is this idea: students will read something and they'll be like, "Is that a real place? Is that a real clinic? Could I go there and find this clinic that Anna was working with?"
Everything's real,
which is amazing that they are, because then we can in turn say, in fact, this is real, and there are other places like it, and let's do some research on it, and so I really appreciate that these are real places.
I think in this area they'll probably recognize that a lot of the inner city hospitals are closing.
Right.
And so, now their health care is now jeopardized, and
absolutely.
What are they going to do now?
Absolutely.
Wow.
Yeah.
Before you came in this morning, we had one of the modules, I think the one that you did, walking in the shoes of someone, which kind of made the students empathize and get into the feeling of the migrant walking. And I think this story does the same thing on the health sector.
Yeah.
Because it puts you back in Peru in this woman's life and how she's going to be fighting tuberculosis. I just wanted to make one further point. Design thinking does something like that, using design thinking to look at the problem from the client point of view, and so look at what the needs are and then respond to it.
Yeah.
In terms of programs, health or urban or education programs, and not the other way around.
Right.
Thinking, what can I do to help people generally, but really identifying those people.
Yeah.
And I don't know, you probably know CARE in Atlanta.
Sure.
They have this approach, the design thinking approach, on children. They work with kids.
I worked with CARE for a year.
Yeah, and it's just amazing what they do.
Yeah. Yeah, Helene Gale was one of our special speakers a couple of years ago.
Yeah, I just love the way they operate.
Yeah.
I can think of two target audiences for these stories. I mean, I think stories are things that pull us in to get us interested in the topic. One is just sort of, education of people, of our children, our citizens, and so on. The other is to get people interested in going into the field. And I wondered if you had thought, I mean, is it sort of anyone to whom these appeal, or did you have kind of a general education audience in mind, or trying to get people to go into the field, or?
Well, I just am really committed to fostering global community and kind of understanding. I'm from rural Iowa, and not a lot of people left my community, so always thinking beyond the insularity in which you live was always something really important to me. So that kind of inspired, because when I left, and I ended up working in different places around the world, I realized that that's not uncommon in some places, but also that so many people have a story to tell. So that fostered kind of my interest in doing this. So I think, yes, attracting people to global health is great. We always need more people. There's actually more and more undergraduate programs in global health at universities. But I think just educating people about global complexity and about challenges of others. So one of the intents of every story is to have some human element that just makes you connect with the person. Now that I'm, at the time I maybe identified as Anna, now that I have young children, I maybe identify as the mother, kind of thinking about the characters. Some characters play football, soccer. Others play, other games that maybe middle schoolers are really engaged with. There's something in every story that's very intimately tied to kind of young people around the world. So, yeah, I don't know. It would be great to get more people in global health, but really, I'm just passionate about fostering dialogue and starting hard conversations. Yeah, like a lot of the issues you brought up from the stories. Because I think actually in every story there's something that resonates with someone's own life, from medical bankruptcy to losing a parent to getting a shot, and thinking it could also be related to some of the anti-vax debates that are going on. Thinking about, well, why do vaccines matter? So there's a lot of ways to really bring this story into conversation. Yeah.
I think of epidemiology and a lot of public health as being a pretty dry field. I mean, it's statistics and data, and I mean, my own dad, that was his whole career, but I kind of wonder sometimes, I'm kind of split because I'm interested in stories, they kind of pull me in, but on the other hand, I'm also, my field is mathematics, and I sometimes have trouble pulling the two together, and I think for someone to actually go into the field, there has to be something, I don't know, for me it would have to be some kind of experience or something that pulls me in, that makes all these sort of dry techniques matter somehow.
Yeah, well, and I think more and more, like my students, for example, when I mentor people all day long. I mean, when you're a professor, when you're a student, when you're a teacher, all you do is mentor people all day long. They're always asking, what should I do? Well, there's two things. What do you like to do? And what are you passionate about? You can use math or epidemiology to study a lot of different things, to do a lot of things. You can have a lot of different jobs. You can be a teacher, you can be a epidemiologist in a health department, you can be a researcher, you can go into policy, you know, you can work for a think tank, you can, you know, be an educator using data. I mean, there's so many things that you can do. That's why when people are like, what is global health? I'm like, it's a movement. It's an idea. It's a commitment. It's you know, an action-oriented idea. It's an agenda.
It's one
Oh, I have to go. Oh, thanks. We'll talk all day. Thanks. Anyway, but you can do a lot of things. Yeah, I mean, I'm an anthropologist, but, you know, I work closely with epidemiologists, and I actually work on social epidemiology
How do
too.
you get that passion about something? That's the thing that I kind of wonder about.
How did I get it?
Well, I mean, yeah, each person is probably different, but, you know.
Yeah, I think you become passionate about what you pursue. I mean, how did you get passionate about teaching? You know, we all have our own stories. I went for 2 weeks on a listening tour with my undergraduate college and learned from Sandinistas about liberation theology, and I was totally changed my life.
What year?
I was a sophomore in college, and I mean, I already was interested in these things, but then it also was a really important way to learn about things. You're not going to go do service or go change something somewhere else. You're going to go on a listening tour, and you're going to read all these important things by Oscar Romero, and, you know, all these really important Nicaraguans, and then go listen to farmers about their lives and learn about global community. That was transformative for me. So it really shifted how I thought about these global power dynamics and knowledge.
Yeah, I would submit that those personal experiences are the things that draw you in.
But sometimes you won't have the courage to do them until you have something to spark an interest. And that's what I hope these books can do. Yeah.